So backwards, right there. Okay, can you guys see us okay? Looks like we're good to go. Cool, awesome. Yeah. All right, awesome. Thank you guys so much for joining with our back pain webinar tonight. We're really excited to have you guys all along. There's a lot of cool stuff we're going to be talking about. So let's get right into it. Remember, if you guys have any questions during this, to let us know. We want to help you guys with your specific questions and really cater this to you.
So this may describe you and what's going on. You have some aches and pains that may be stopping you from doing what you want to do, doing what you love to do, playing with your kids, playing with your grandkids, playing racquetball, whatever that is. You have a little pain. The pain causes you to avoid that activity, that thing that you love doing, riding the horse, whatever. Take a little pain medications that might allow you to return to what you're doing. But then the pain ultimately comes back. You just cycle down through this cycle and this spiral many times, and then 2, 3, 5, 10 years down the road, possibly you're getting surgery or you're not doing what you love altogether. And so hopefully we're going to help you be able to break that cycle, give you some tools, answer some questions for you.
I got to tell a story about this since we're talking about back. So one of my all-time favorite patients, I was working out in Tooele Valley, and she was told 31 years prior to me working with her that she had to either get surgery or just deal with her pain. And 31 years later, she's just been hindered. She was a mom with I think she had 2 young kids at the time. And so she's like, I can't get back surgery and be laid up. I've got kids I have to take care of. So she just dealt with it and avoided activities and did all of these things. And then 31 years later, we actually were able to fix her pain. So it's not always going to lead to surgery, but her quality of life was poor for a long time. And she was extremely frustrated when we fixed it because she missed out on so much and she didn't know there was a conservative treatment for it. So ultimately, quality of life or surgery, avoiding activities, missing out, let's not go down that path.
That's what we want to help you do. We want to help you have good quality of life.
So we've got a couple gifts that we're going to give you guys. At the end, there's going to be 2 free things. And so stick around to see what those are. And there's really good information.
We're also giving away a free backpack tonight. Hopefully you can see that in the camera.
Yep. So the backpack is if you to get in the drawing, literally it's only anybody on the webinar live right now. So I think there were 6 last time I checked. And so, I mean, we only have 1 to give away. We'd love to have 6 of those for you guys, but 1 in 6 chance is pretty good. So for you to get in on that drawing for the backpack, all you have to do is ask a question once during this whole webinar. And that question about a specific injury or a specific treatment, stuff like that. And then we'll throw you in the drawing. And then right at the end, we'll do a drawing for you guys.
So here's a list of common low back pain pathologies, problems, things that you may have heard. So we're going to come back to this slide a little bit later, but we want to get you thinking. Have you been told or heard about degenerative disc disease, DDD, or scoliosis, muscle strain, SI joint syndrome, so bulging discs, radiculopathy? If you've heard of any of these and you have questions about them, or you've been told maybe that you have this, we're gonna come back to this. So be thinking about questions that you may have. Your problem may not be on the list, and that's okay. Throw it out there. Ask us a question about it, and hopefully we can answer and respond to that question.
Absolutely. So the main thing you're going to learn tonight is all about how when we change the way we move, we're going to change the way we feel. So if you keep doing the same thing you've been doing, you're going to get the same results you've always gotten, right? Some famous guy said that one time. So the whole goal here is to motivate you to make that change, because change isn't always easy. Even we get comfortable even in our own pain. So first, we're going to learn what movements need to change with what you're doing right now in your life. Learn how different joints work together. We're not just talking about the back, but how do all the joints around the back work together? How does balance between flexibility and strength, how does that play in with this? And then what are some exercises to help you get moving again and get back to living pain-free?
Hey,
Cool
Brad,
things.
John,
Yeah,
Yes.
your slides are not showing. Are you showing a PowerPoint?
we are. Okay, so
It is not showing.
click that one. I am glad that you are sharing that. Thanks, Megan.
So Emily caught it first. So thank you, Emily.
Good job, Emily. Thank you.
Can you
There you go.
see it
Now we
now?
can see it.
Okay,
Yep.
thanks. Sorry, guys.
No worries. Happy to help.
Thank you. So we'll so use the right here. Click that button.
Okay, we're going back a little bit here so you can see the list of back injuries that we were talking about. So again, you have degenerative disc disease, scoliosis, muscle strain, facet syndrome, SI syndrome, sciatica, radiculopathy.
And let's show a couple other things just so you guys can see our awesome artwork here. So here was the cycle one. I like this because it really helps you get that idea of how we fall into the cycle and the pain gets worse, right? And then obviously our gifts. Cool. So these are the things we were just talking about, what we're going to learn during this webinar. If you guys have other specific questions or goals, things you want to learn, make sure you just throw that in the comments. And now we can actually see the comments. So this is way better.
Awesome.
Thanks for being patient with us, guys. Okay.
Okay, so some things to consider and think about. So ideally, if we have something going on, we're going to fix the movement problem or the disorder before it becomes an injury, before it becomes a real problem. So if you have some movement dysfunction that's going on, the best step and the best approach, the quickest approach, is going to be to fix it before it turns into an injury. We want to talk about that, and we're here to help you avoid having the injury in the first place. If you already have an injury, now what? Now where is your mindset? What should you be thinking about? And hopefully you're thinking about, okay, now how do I fix this acute injury or this simple injury before it really progresses down the road and turns into needing surgery? We really want to help you avoid surgery. We feel like that we offer great conservative treatment plans and ideas to help avoid the surgery. Surgery is scary, especially with your low back. And so we hope to help you avoid going down that path.
Okay, so low back injuries, if they're not treated, what's going to happen? Right. So that same patient, 31 years of that pain. So inactivity, because we have to avoid activities that cause a lot of pain. Your muscles are going to atrophy. The spine alignment's going to change. Has anybody noticed that they've got a bump here on the upper back, or maybe their back's really flat? Those spine changes are going to happen. It's going to lead to core weakness and actually pain and damage to other tissues around it. So our whole body's connected, and that's going to be a problem. We can have other issues that come up too. One of the leading causes for neck pain is actually low back pain. And so headaches, hip issues, SI joint, people all the time are like, I have sciatica. I've had back pain for years, and now I've got sciatica. Well, if we had fixed the back pain, sometimes you can prevent that sciatica from coming.
So a story along the line of Brad's, helping this gal that had been suffering for 31 years and told that she couldn't do anything. I had a patient early on that I was working with him, helping him get his back better and feeling better. And after a few visits, he came back to me and he was genuinely in tears. And he was telling me, John, I'm doing things that I haven't done in 10 years and that I didn't think I would ever do again. I'm playing with my grandkids and being able to just be with them and spend time with them. And so really that's what we're trying to help you avoid, that inactivity, avoid missing quality time and quality parts of life.
So there's a couple different ways that we can manage pain or manage our injuries, right? So if actually, let's get everybody to chime in on this. So I want you guys to pick 1, 2, 3, or 4. Just start from the top. I know they're not numbered, but so extra passive, active, or extra active. Put down what you've done and then comment again as what you want to do. Okay. So extra passive, doing nothing, right? Like literally nothing. I just avoid activities. I'm I don't even take medication. I just deal with it. Passive, I'm doing surgery. Someone else did that for you. Medication, you're not doing anything, steroids. That's a very passive treatment. And those are sometimes very important. I'm not throwing that out here. And then you've got active, where I'm going to improve my movement. I'm going to fix mechanical errors and actually fix the problem so that I can get back to my normal life. And then extra active is injury prevention. I'm not even injured, but I'm here on a Wednesday night at 6 p.m. watching a webinar and learning how do I prevent that injury from happening. If you're not injured and you're on right now, then you're extra active. Maybe you're on here because your spouse is injured or someone you know is injured, and that's extra active, right? Mm-hmm. So I love that. So we've got some people who are commenting saying that they've been passive, they've done the surgery or the medication, but they want to do the extra active. It looks like, Emily, are you saying you've done both? You've done the extra active and the active? That looks like what you're saying there. So that's awesome. So
I've current back.
So actually, I'm a huge fan of active recovery. But I had recently injured my spine doing the stupidest thing, and it was ridiculous. And so I'm here to learn how I can do better in the future, basically. Awesome. And I'm still struggling a few weeks out of my injury, but I obviously am a huge fan of taking an extra active or active approach to preventative anything, really, honestly.
Yeah, that's awesome. And so you're doing both, right? You're doing that active, I'm trying to improve the way I move, but then extra active, how do I prevent other injuries from happening? So I love that.
Thanks, Emily. So this slide shows, I got too far. So we're gonna kind of hit 5 areas, five general topics tonight. First thing we're gonna talk about is anatomy. What does your back look like? What's going on? We'll talk about movements, daily movement patterns, other joints that can and are typically affected by back problems. How can you manage the pain? And then now what? Now what are we going to do?
Okay, so some of those joints and different parts of your back, we're going to get into a lot of detail here. The reason we like to cover this is because the enemy that you know is a lot easier to deal with, right? So if we understand our back, and I'm not trying to say the back's your enemy, but the back pain, right? We understand how the different tissues work, the bones, the joints, the ligaments, the muscles, all of that, how they work, how they are lined up. You're going to be able to understand why we're doing what exercises we're doing and why certain things hurt when there's a problem. So first off, in your back, there's 33 bones. That's a lot, right? And how do they stay in a column together? There's a lot of ligaments and fascia holding your whole spinal column together. And as you can see in the picture here, that's a really fairly good curvature of the spine. Most of us don't have that good of a curve. And so we need to do better stuff with posture, with doing more back bend, stuff like that to maintain that. I'm jumping ahead. So, but the point is we've got facet joints here on both sides. So you've got 2 on each side going all the way down. You've got ribs that attach from that thoracic section. So that's the green one, I believe, right? Mm-hmm. So that green section has ribs attaching at every level there. All of us know, right? 12 ribs on each side, 24 total. And so, the spine is rather stable. You're not going to get a lot of wrong movement with the spine until we tell it to do something wrong.
So this slide here shows each of the vertebrae. So we have the bony parts, right? And in between the vertebrae, the blue parts represent the discs. That's what we hear about, right? I have a bulging disc. My disc is bulging. And then the yellow part right behind the disc, those are the nerves. You can see how those discs and those nerves are really closely related in a healthy spine. So if your spine becomes unhealthy, then whether that means that the bones around the nerve are starting to pinch on it, or is the disc pinching on it, is the bone, is the vertebrae sliding or slipping or moving, that's where you start to have problems, and that's where we start to have the pain, because the nerves are getting irritated with everything that's going on around it.
Yeah. Can you guys see our mouse on the screen? Go ahead and move it a little. Can you guys see that still?
Maybe not.
Okay, so just wanted to know if we're able to point with that. So those vertebrae, how this all lines up, that's one of the main things. Okay, Emily and Megan said yes, so that's awesome. I'm glad that we can point with that. So you can see how that's a problem when they're right next to each other. That's a really common one. One of the most common things is I've got a nerve symptom, right? Whether that's any of those conditions. So let's go on to the next slide here. So working our way down the spine at the bottom, has anybody heard of the SI joint? That's a really common thing where people maybe after pregnancy, right? Or maybe
a really hard fall on your low back or tailbone.
And what's really cool with this, and I think we'll talk about this more later, is that understanding that when our SI joint is the problem, we could have pain in the side of our hip. And so I've had people come in and say, I was diagnosed with trochanteric bursitis. That's pain on the side of the hip, right over that bone. And we did some assessment and found out there was no problem there. There wasn't any inflammation, but it was actually the SI joint was really inflamed, and they had a fall and landed on their back. And so that's something really good to understand, is how those all relate to each other.
Yep. So, one thing to hopefully help you appreciate and understand, so you have your tailbone, right, your sacrum, and then we have these pelvic bones out here, and they're literally 3 different bones. And so that SI joint is where your tailbone and your hip bone join together. And that's where the problem is. So this slide shows a little bit more about the nerves. So we've got the spine going down, and all of the kind of whiter, I hope I said that clearly enough, that's ligaments that are kind of helping to hold everything together. The yellow part again is the nerves, and you can see where as those nerves come out between the spine, between the vertebrae, then they're coming out and they're interacting with the muscles in your low back. They're coming together. These nerves down low all come together to make the sciatic nerve. So then if you go over to this image on the left side, that big yellow part, that's the sciatic nerve. And that nerve is really, really big. It is, first time I saw it as I was dissecting in physical therapy school, I saw that nerve and it startled me because it was so large. And you can see how piriformis, all these muscles in the hip are really closely related and interact a lot with those nerves.
So did anybody have realized how big that sciatic nerve was? I mean, it's huge, and so if you push on that hip, you can get to it pretty easily. And it's kind of cool looking at this too, where those nerves go everywhere, right? So you can see how complicated this really can get. Okay, this is probably my favorite slide in the whole thing. I love this topic. This is all just to help you understand how important it is to find the cause of your injury, not just the symptoms. So if you've been told or you've felt like, man, my back hurts or my hip hurts or my groin hurts, that doesn't mean that that's where the problem is. So these are some pictures of referral pain patterns. But even more important than just these pictures is understanding that a hip problem, like arthritis in your hip, can have 0 hip pain and a ton of low back pain, or vice versa. If you have a bulging disc that's smashing on that nerve and you have a lot of groin pain, I've actually had a couple patients who had testicular numbness. Mm-hmm. And so you can get symptoms down the kinetic chain where your hip's killing you, your knee could even be a problem, but it's something caused by the back or the SI joint. So we've got to make sure that we're treating the right problem. My analogy for this is if you're in a boat that's sinking, you don't want to just scoop out water. You want to plug the hole that's leaking, right? So find that hole, plug it, instead of just spending all your energy and money and MRIs and scooping out all the water.
One way I like to think about these referral patterns is I think most people have heard, hey, if I'm having a heart attack, I may have pain down into my arm, right, into my shoulder or my arm. Well, that's not because you have a problem with your arm. It's just how pain is referred in our body. So the problem is at the heart, but it's referring pain down into the arm. Not everybody experiences that with a heart attack, but it's the same concept, same idea with the back. Pain can be referred other places. If you look at this bottom left picture, it shows pain in the glutes, in the buttocks area, and people will have pain in their bottom, and they'll think automatically, oh, I have sciatica. Well, maybe, but maybe not. It may be coming from another area. And so that's a common thing that we hear. People come in, they have pain in their glutes, and they automatically think they have sciatica when that really isn't the problem.
Yep. All right. So think about how you move. A lot of us are like, oh, I just hurt. That's as far as our thought process goes. But how are you moving? Well, you know, I sit at a desk for 8 hours a day, and I get up once or twice to go to the bathroom. I should get up more often, get a drink. When I go home, I sit in a car for an hour in traffic. Maybe I lift for work. And when I lift, I don't lift that great. I'm bending a lot. Squatting just takes a lot more effort. So I'm just going to bend over. How are you moving? And what postures and positions are you putting your body into? And because of those postures and positions that you put your body into, your body will adapt to that. Automatically, it's adapting all the time, even right now as you're sitting here watching this. Are your shoulders rolled forward? Is your head sticking out? Are you slumped in your chair instead of sitting up tall? Do you have a lumbar support that encourages you to maintain that good postural spinal alignment? Muscles adapt, and so they're going to get tighter in where the spots where you get short. Like if we're slouched in a chair, your stomach's getting tighter, and they're going to get weak and elongated on the other side. So your low back muscles might be really, really weak because you slump in a chair all day typing on a computer.
So this image shows about how our spine and everything changes. And if you look at the far left, our head weighs about 10 to 12 pounds. So if it's perfectly vertical, we're not going to feel a lot of stress and strain. And as you work your way to the right, you can see how that head moving forward is then going to increase not the weight of your head, but the force that you feel on your neck and your upper back. Now, as everything changes in the neck and upper back, that's then going to translate down into the lower back and cause problems down there. And if you look at these pictures really close, you can even see how there are changes in the hips and the legs. This one to the far right, there's a little bit of a change in where the pelvis is. It's tilted a little differently. And the knees and the legs are in a little bit different position. So really that posture can affect everything all the way up and all the way down. So we're kind of talking in these images about the neck and the head, but if there are problems in the low back, that can also translate up as well as down.
So you can see here in these pictures, these are some of the postures I was talking about. Laptops are horrendous for posture. And so you should only use a laptop when you have to, like maybe if you go on a flight and you're in the hotel on a business trip or whatever. But when you get back, jump back on your desktop as soon as possible.
Or use it sparingly on your lap.
Yeah, absolutely. And so this is actually the picture on the left here. You might be thinking, oh, that's funny, we're exaggerating. That's actually how you look. You just don't realize it. Have somebody take a picture when you're not thinking about it, and you'll see how bad that really can get to. So then right next to it, you can see this picture with that corrected spine. I mean, he does a great job here showing how much that low back can curve in, how the hips tilt forward, adjusting to support your back because of that poor posture that you stick yourself in. Maybe you're sticking your butt out when you're walking around, and that's just a habit. Every single person I've ever worked on with this, when I try to get them to adjust that, it doesn't matter if they're tilted forward or tilted back too far, and we're trying to come back to neutral. They're like, that's weird. You don't do that. This is how it's supposed to be because your body is adapted to it, and like we talked about, muscles got shorter or longer.
I don't know about Brad. So here's my twisted physical therapist mind. whenever I go to the store and go shopping or go to the mall, I find myself all the time. I see people with this horrible posture, like this guy that has the big red circle. And I'm like, oh, you are going to be coming to see me in my clinic. Thank you. Thanks for having that bad posture for me. Not really, but I do watch people's posture, and sometimes it's like, whoa, it hurts me to just look at how they're standing or walking or moving. Posture and that spinal alignment is huge.
And we threw on here that at the top right, we already are giving away one of my favorite exercises. This is one of those things every living human being should be doing 1 minute of this every day. So that's that wall posture position. You get up against the wall, you keep your stomach tight, and then roll the shoulders back and tuck the head in. If you do that 1 minute every day, you're going to be one of those 80, 90-year-olds who's still out playing racquetball or still standing up tall. Instead of, I've worked with a couple, and it's just hard. It's hard to see because you can't undo that much structural damage. I've had 88-year-old patients who are completely rounded forward in the back, and the head is sitting almost in their lap, and they can't undo that, and they have a lot of pain. So at that point, it's just how do we manage the situation you're in? So instead of getting there, let's prevent it.
So there's one tool for you. Hopefully you can take that and you can include that in your day, include that in your routine, whether you're getting ready in the morning, before you go to bed. Stand against that wall for 1 minute. Shoulders back, keep everything in line against the wall, and really work on that posture and reteach yourself. It may feel really, really weird. It may feel really bizarre, but this is something that you can do in that kind of preventative, active care that we talked about earlier.
And I got to add real quick, this is not how you should walk around and stand all day, every day. That we're not robots. We're meant to move. Our body's built to move, bend forward, but we need to come back to that more often.
So how do you move? Question for you. Do you have pain or problem getting up from a chair? Or are you lifting tons at work or at home? When you squat, do your knees move first? Where are you experiencing pain as you move? Is there pain? Are you experiencing pain when you're sitting in your car? This is Brad's car.
Yeah, maybe someday.
Or, do you find yourself falling into your car? Or maybe you bought an SUV because it was hard getting into the car, and now you can fall in or fall out of the SUV or the truck. Do you know how to roll to get in and out of bed? Maybe you are having a little bit of pain and discomfort. One of the worst things you can do getting out of bed in the morning is sitting straight up.
And that's not just injured people. That's everybody.
Healthy, yeah.
You're healthy, you should still log roll out of bed because that's what's helping you protect your spine. When I get up in the morning, it's just habit now. I didn't always do this. I had to teach myself, but I roll to the right, throw my legs down and pop up and go. I used to, 5-6 years ago, I would just try and pull myself up. And I was like, man, why is it so hard to get up in the morning? And I'm only 24 years old. Well, that's because I was doing it wrong.
Yeah. So some things to think about, things for you to ask yourself: how am I moving? How does it feel when I move? And how am I getting in and out of bed?
And so Megan said that she's one of those people at the grocery store who's slumped over. And so that's a good thing to recognize. And maybe you have a purse that you wear just on that one side, that's going to pull you down. If you have a cart, you're leaning on it, stuff like that. So throw in the comments below what activities are hard for you, getting out of the chair, carrying stuff, or the car, or anything else. Just throw it in the comments for us.
Hey, Susan, we saw your comment. We see that you're there, and we saw that you typed in. We've got our chat open. So if you have a question, go ahead and type it in there, or maybe you need to unmute yourself when you want to throw that question out. So you're here. We see you. We're glad you're here. Thanks for being with us.
Okay, so we want to get into some of these movements and helping you understand, how do I fix this? This is way easier in person. This is something that if you're having problems and you have this ongoing back pain, work with a physical therapist. Obviously, Rocky Mountain, we're the best ones, but find a physical therapist who's going to give you that hands-on treatment and guidance. So right now we're going to give you some of those tips, and hopefully it's helpful. when you're squatting, let's go into squatting first. I'll do that if you want to do lifting. Is
Go
that
for
all right?
it. Yep.
So when we're squatting, you want to move your hips first. The joint that moves first is what's going to take the majority of that load. So as you can see in the picture, the hips sliding backwards, stick your butt out before you even start bending your knees and then start lowering down. The majority of you will have a hard time with this. It'll feel like you're falling backwards. And that's same thing as before. When we're fixing a movement, it feels awkward. Change is always going to be a little uncomfortable, but in the long run, that's going to save you the knees, like prevent or reduce your need for a knee replacement, offload your knees, and protect your back.
So lifting, a couple of pointers for lifting. Likely you've heard this already, but if not, again, something to think about. You know, if you have boys, teenage boys, or even young men, are they just bending straight forward at their waist and trying to lift heavy things? I can tell you when I was young that's how I did it. I don't know why it seemed easier, but I just bent straight over and then lifted straight up. But really what you want to do is you want to get down into a deep squat, and you want to use your legs, and you want to make sure that whatever you're lifting is close to your body, not straight out in front of you. So just a couple of lifting techniques, things to keep track of. And if you recognize and see these abnormal patterns in family members or friends, don't be shy to redirect them. You're helping them, preventing them to have to come and see us.
And the definition of an expert is someone who's one step ahead of the other person, right? So you're now an expert to an extent on this lifting. You can tell them, hey, look, I don't totally understand lifting, but you're bending at the back, and give them some pointers, or if it's bad enough, send them to us and we can help guide them on that. Okay.
So we want to, as we're considering the back, we want to consider joints above and joints below. So we're kind of talking about the low back, but we've already talked a little bit about the SI joint in the hip, and we've talked a little bit about the upper back and the thoracic spine and even the cervical spine. So those are things that we want to look at, that we want to keep in mind. If you're having therapy, or if you've worked with people other places, hopefully they're looking at that and they're taking it into consideration. Something for you to keep in mind. If they're not looking at that and they're not keeping that in consideration, maybe you want to consider going somewhere else. I mean, we would love to have you work with us, but definitely something to have them keep in mind and for you to keep in mind. Anything else you want to say?
Well, I forgot from the last slide. I want to point out, if you guys aren't following us on Facebook, we're posting twice a week these live videos where John and I just want to educate and give you guys as much. We want to impact you as much as possible. So go back to, maybe it was 3 weeks ago, we talked all about these lifting techniques that we were just covering over. So you can actually see a video of us doing everything wrong and then doing it right and showing why that's happening. So I just want to make sure to include that. And then real quick to answer, Emily, you've got a really good question there. Things getting back to normal is really, really good, but it sounds like you still have some of those nagging pains, those aches, and that means there's something else still going on. And you want to fix that completely, like we talked about in the beginning. You'll, without even realizing, you're avoiding activities, and that's going to lead down that spiral. So turn around and head back up the other direction.
Yep. And hopefully we may give you some tools as we go further on, Emily.
So SI joint, like John was talking about, right? It's part of, it's not part of the spine, but it is, right? Like it's right there next to the spine, and a super common cause for that pain that you'll have in your low back or pain into your hip. So let's find out if that is the cause. There's this really cool technique that John went and got some advanced training on, and he's taught me how to do it as well, to actually find out if that SI joint, which Emily, it sounds like this might be applicable to you, but if that SI joint is the problem, then there's a specific test that we do, and then there's some taping techniques to support it, and then exercises to completely turn that around.
Yeah, so if your sacrum is feeling a little twisted, that's something that we look at, and we can certainly give you some support in efforts to minimize, give you some relief, And then you can learn good movement patterns on top of that when things are in a proper position.
And this is a good time to share. I want to share this story. This was right when I was a student. So I don't know if you guys know, but as doctors of physical therapy, we have to do rotations. It's like the medical doctors. And on one of my rotations, the very first week, I had 2 patients. One was Monday and one was Friday, and they were exactly the same. They were both in their 80s. They both had 7 levels in their spine were fused together. And they both started when they were in their late 30s, when they first had their first fusion. My CI was incredible, very smart physical therapist, and he did some tests with them and found out both of them, by the way, had pain their entire life. The surgeries, the fusions didn't change anything. It didn't work for them, for either of these guys. And he did some tests, and both of them actually had an SI joint problem. And so it was really cool to see as a really young PT just getting into the field, and as I was graduating, going through school, to see that that was something that was unfortunately missed. And he got rid of their pain in only 3-4 weeks, which they dealt with for 50 years.
That's a rewarding thing about our jobs, is being able to really help people have some relief. Here's a couple exercises. You want to talk about these?
Yeah. So these exercises, they might look a little complicated, but these are meant for the SI joint. And there are more that we do, but this is just a really good start, where we can pull on the legs and use the muscles in the hip, which are pulling on your femur, to stabilize and move those SI joints, not move, but activate the muscles around those SI joints to really get that pain to go away. So a lot of exercises have shown to reduce inflammation, which will reduce your pain, and then stabilize those joints so they're not so unstable or twisted or uneven.
So, I mean, just to talk about these pictures a little bit, the top center one, this gal is pushing her knees together. If you go to the one on the right, she's pulling her knees apart and giving some pressure. And then on the bottom left, she's pushing down with one hand and pulling up with the other hand. So these are techniques, muscle energy techniques we use to help things kind of reset and minimize some of the pain and the discomfort that you're having. So each of them are appropriate for different things. It's not really just a gunshot to go out there and do all of these, but these are some things that we can do to help that SI area.
Okay, this exercise we talked about earlier, but we want to show you guys again what can happen. The posture on the left looks bad because you can see the posture on the right, or in the middle here, you can see that difference. But if it weren't for those other pictures, it probably would look pretty normal. On that left side, rounded, you can see his back's flattened out, his gut isn't active at all. So he's in the middle, he's doing that wall posture exercise, really straightening out, holding himself up tall, activating the core, and then he steps away from the wall, and you can just see how much healthier that is. His spine's in line and a lot better.
And hopefully with this image, you can see on the left, see how his head is really forward, and hopefully you can envision all the forces that are being placed on his neck and his upper back by that 10 or 12 pound head really falling forward. Where you go to this image over here and everything's in line, the energy required to hold it there is going to be much, much less. So again, we don't want you to become necessarily a military guy, and no offense to the military guys or gals out there, that's not what we're trying to create, but we want to have a better positioning than this guy on the left.
Yep. Now the exercise here on the right is really good, but it is more aggressive. So I highly recommend not jumping to this one. If you're younger, maybe your body can handle jumping up levels, but for most of us, we want to work up to that gradually. So this one, though, works really well to help get you that range of motion, that extension. Like we talked about, we flex forward 3,500 times a day. How often do you go and fully extend or even extend backwards past your neutral? So this is another exercise that I use to help people move more.
And make sure that those spinal segments are moving freely.
Yep.
So, we should have changed this. 7 tips to pain management. So
we took out one.
So some things to keep in mind. Rest, ice, compression. The one that we took out is elevate. It's kind of hard to elevate your back, right? If you have an ankle sprain or you have a wrist or an elbow injury or something, then you can elevate it. But the first thing we want to do is we want to rest it. Rest within reason. So we'll talk about this a little bit more as we go into some of our future slides. But we do need to let things kind of calm down with a little bit of rest. Ice, especially early on after an injury, if you have an acute injury, ice is amazing to help things calm down. A little bit of compression, a little bit of pressure.
We use tape a lot for that.
Yep.
That is one. The back is hard to compress, but they do have some back compression or bracing. Bracing's awesome. We did another video all about the Aspen back brace, and that's a super powerful tool. But KT tape and Leuko tape are some other tools you can use.
Yep. Stop checking and rechecking. If you know that when I bend to the right and I tilt a little bit backwards, that makes my spot hurt. And then you wait for a couple hours. Does it still hurt? Oh yeah, it still hurts. And you wait a couple of hours or you wait a day. Does it still hurt? Oh yeah, it still hurts. Avoid that. Avoid checking and rechecking, because if you're going back to that spot that causes pain, well, you're not letting it calm down, and you're slowing that recovery phase. Medication, we believe strongly in conservative care. Sometimes medication is necessary, but we have a lot of tools that hopefully we can help you not have to become really reliant on the medication. We have the opioid epidemic that's going on, and we have some tools that can help you avoid too much medication. We want to strengthen it. You want to strengthen not only the area that's injured, but the area around it. And finally, see a physical therapist. We think that we're pretty top-notch here at Rocky Mountain Therapy, but yeah, we would love to see you.
Yep. Yeah, and with the medication, it's something that I encourage a lot of my patients: take your medication before you go and get into those activities, because it does free you up to move, and the movement's what's going to actually fix you when that's needed. We just got to be conservative and cognizant about how much medication we're taking. And we've worked with a lot of really good doctors who are on board to try and help you. How much do we actually need? How do we utilize it so it's helping you, not just masking the pain? So what's next? I get that most of you, that's the question. Like, okay, where do I go from here? It's awesome. Like, we've learned some good things, some good exercises. How do I prevent injuries? What's next? So keep moving. We just talked about that, about rest is important, right? So rest, what does rest mean? Rest, should I just rest? Did you guys know 25 years ago, back when John was graduating from college?
Yeah, unfortunately.
No, so 25 years ago, they were teaching that we should just do nothing, right? Like 12 weeks bed rest. And that was it. Well, the problem is that they found out people's muscles atrophy a ton. It only takes 24, 48 hours for you to start having some of those atrophy signs. But after 8 weeks, 50% of your muscle mass is gone.
Yep. Limp noodle.
Yep. And that's going to be way harder to come back from. So we want to rest, but we want to active rest. So what that means is we're going to be smart about which activities we're picking in the beginning. There is some of that activity modification. Maybe I'm not picking up or vacuuming, or I'm not twisting, right? Maybe I'm not dancing right now, but we're going to get back to that as quickly as possible. And you're going to move how you can in your pain-free range and zone and in that safety.
So we want you to move better. We want you to improve your mechanics, kind of like we talked about earlier: standing and sitting from a chair, lifting. Keep those things in mind. Work on your posture. We've given you that one exercise, that tool that you can start to use and start to apply every day. And if you feel like that, man, I'm not moving well at all, get help. Go somewhere and get some help.
And understand not all injury or all pain is due to an injury, right? Sometimes I hurt because I've had family members who will shoot me a text and be like, my back's hurting right now. And I'm like, okay, well, what have you been doing? Well, I went and I shoveled for 8 hours on Saturday. And I'm like, okay, yeah, your back should hurt. You're not injured, you can do stuff about it. You can give it some ice and heat, and you can do some gentle stretches and movement, and that's going to calm back down. But yeah, that just happened because you used it.
And finally, see a physical therapist. We really are. We have great information to share, great knowledge. We can get you back on course and get you so that you can go back to doing those activities that you want to do and help fix your movement and minimize your pain.
Awesome. So what most of you are thinking, well, what can I do at home, right? Like, I want to get going on this already. So motion is lotion. Move in your pain-free zone. I guess I kind of said some of these things. I tend to jump ahead. I get too excited. Strengthen your upper back. Stabilize your hips. Get your core active. Get these in simple ways. One of the coolest things after a total knee replacement or a total hip replacement is that you can even just sit there and squeeze the muscle. You don't even have to move. Like, you don't have to change your knee range of motion and just squeeze the muscle, and that's going to reduce your pain and get you back a lot faster. But understand, with everything that we're teaching you, every injury is different. Everybody's body is different with the same injury. So be safe. Don't do anything that you don't feel is safe for you yet. Or if you need to, then get seen by somebody, get an assessment done before you get started on a new exercise program.
That top one I love, motion is lotion. Movement, movement, movement. Is that going out and walking around the block? Is that just moving around your house? Really, one of the worst things you can do in general is to stop moving, stop your movement. So keep moving, even if you are healthy. Keep your body going, and that's going to keep the joints well and healthy.
And one of our patients talked about that today. She said, well, I just don't get, why am I not getting better? And I said, okay, well, let's talk about what you're doing. And she's like, well, I do my exercises. I was like, great, once a day. Okay, maybe we could do a little bit more. What do you do after that? Well, I'm on the couch for 12 hours and I just lay in my armchair. Okay, you're not moving enough. Like, we can't stay put for that long because the muscles atrophy, and you're not going to win with 10 minutes of exercise and 12 hours in an armchair.
Yeah. So these are a couple of other exercises that you can think about and maybe adopt. So on the far right side, you can see that gal is on her hands and her knees, and she's on the top, letting her back kind of sag down. And then on the bottom, she's arching up. And so that's another way to move your spine, make sure that it's being mobile, and that mobility, going back to the motion is lotion, that mobility is going to help your back be healthy. Now, you don't want to go to the point that it's making it hurt. We don't want to go to extremes, but keeping it moving in general is going to be good and healthy for it.
Yep. And so moving up to the left from there, you can see the guy pressing up backwards. That's the extension that I feel like I've beaten to death. We've got to get our spine moving through its full range of motion, not just halfway. If you did a bicep curl and you only lift up halfway and that's it for, and you're lifting 30, 40 pounds over and over and over again, pretty soon that's as far as you can move, because your body will move in the range of motion and mobility that you give it.
The gentleman on the bottom center, he's bringing his knee up towards his chest, towards his stomach. And as he does that, he's stretching the glutes, but he's also stretching muscles into the low back. And so this is one way that if you're feeling a little tightness in your low back, this is one thing you can do. Bring that knee up to your chest, hold that stretch for about 30 seconds. Do the other side, hold it for about 30 seconds, and that's going to take the pressure and the strain off of those muscles. It's going to give them the therapeutic release that they need.
And then top left over here, this is one of my other favorite exercises. This is a transverse abdominis muscle. That's one of your core muscles. You're activating that by pulling your spine down into the table. If you saw our Facebook Live this morning, we talked about this. Mm-hmm. We talked about what is your skinny muscle. If you're taking a family photo and your spouse smacks you in the stomach and says, suck it in. That's, my wife says that to me all the time. And it's this muscle. You're activating that core muscle that's going to stabilize your spine, and it's really your internal girdle that just sucks you in and stabilizes that spine. But the cool thing is it's mobile and It moves with you.
Yep. Emily, you're right. That far right one, it's often called a cat-camel pose. in yoga. Sometimes people call it the angry cat or whatever.
Yep.
But yeah, definitely those positions are used in yoga frequently. Yes. The bottom left one, this guy is stretching out his hamstrings. And again, your hamstring, well, not again, but your hamstrings attached to your sit bone. So if you're sitting in your chair right now and you feel that bone that you're sitting on, that's your sit bone. That's part of your pelvic bone, your ischium. Well, the hamstring attaches along the back of the leg onto that sits bone. And if that hamstring is tight, then that's going to cause your pelvis to shift forward and or backward. And so even though you're stretching the hamstring, you're affecting the low back because you're allowing that pelvis to rotate back where it needs to be. And that's then going to take stress and strain off of your low back.
And let's be honest, our society, most of us have way too tight hamstrings from sitting too long. That's one of the things that some of my patients, I used to work in the neuro rehab unit, and a lot of them were stuck in wheelchairs. And so hamstring stretches, we were working on a ton so that they didn't get too tight.
Yeah. So hopefully these are some exercises and tools that you can kind of look at and keep in mind when you're doing the stretches. We like a 30-second hold, and that's going to, again, let those muscles give that therapeutic release. So, if you're just feeling a little stiff, a little tight, a little discomfort, these are some awesome exercises and tools to use.
So a couple other just quick to run through here. Stretching out, I'll start on the bottom left here. This is a piriformis stretch. That's a deep muscle inside your hip. So pulling that knee to the opposite shoulder and obviously working to that gradually. But that can be really important with sciatica or hip problems or even low back.
The one in the center, these arrows are showing him kind of rocking back and forth, left to right. You want to do it in a pain-free range, but as you go left, feel a little stretch, go right, feel a little stretch, just a gentle rocking back and forth, again, to hopefully help those muscles in the low back feel some relief from the tightness that they may have.
And based on what we've shown, you've seen a lot of posture and mobility stuff, but we want to get stronger, and there's a lot more of strengthening stuff we could be doing. But one of the ones we wanted to include here on the bottom right is that bridging. So you get in on your back, hook lying position with your feet up flat on the floor, and then you're going to lift your hips up off the table. It's important that you do this one correctly, activate your glutes. You can use your hamstrings too much or maybe arch your back too much and cause problems. So don't jump into this one if you're not ready, or if you need guidance, see somebody who can teach you how to do that correctly. But that's a really good exercise. Get those glutes firing again, because that is the biggest problem in our society is our glutes don't fire. We don't use them. You don't need them when you're sitting, other than for a nice cushion. So physical therapy, great quote. You can lead a horse to water, but you can't make him drink. So physical therapy, pros and cons to it. You've got to do some work. This is going to take time. This is going to take effort on your part. It's not passive. If you guys remember that extra passive, this isn't part of that beginning part. If you want that, that's medication. You can go get surgery and stuff. But if you're looking for that more active or extra active role that you want to play, then it's going to take some work. You're going to be stronger. You're going to move better. Your quality of life's going to be better. It's not invasive. I like that. Progress takes time. It's going to improve over time, but there is going to be some pain too, right? Now, there's a difference between good pain and bad pain. We won't go into all of that, but there's going to be some of that discomfort as we get stronger and we move in ways that are difficult.
Some people, I've heard people call physical therapy PT, pain and torture, and that's not our goal. But as you're learning to do new things and trying to come out of bad movement patterns, there may be some discomfort. But that's not our goal. Our goal is not to make you hurt. But it's not uncommon that you'll experience that
if they're late for their appointment.
Those are your patients, not mine.
So go ahead.
So this is kind of a typical healing graph. So if you look on the bottom, time, and then on the left side, the progress. We want to get better, right? So the dotted line is what we expect, or what we hope, or what patients hope is that, hey, it's just gonna be this smooth transition from where I am to getting better. In reality, if you see this other line, It is all over the place, forward, back, up and down, and sometimes we get discouraged, and sometimes it's hard to not get discouraged. But when you're working with a physical therapist, hopefully they'll help you to navigate through that and help you understand why. There are lots of reasons why, but don't get discouraged as you're trying to make that progress and get back to where you want to be.
Yep. So we've got two things we want to give away to you guys. So I told you guys in the beginning we were going to give this away. These are completely free. There's no obligation. We just want to get out education. You can see that on all of the stuff we're putting out there. We're trying to help you guys as much as possible. So there's a free ebook. Some of you may have already downloaded that. Awesome. But if not, then you can get that. There's a link for it on all of our social media out there. So our website at rmts.clinic. And then Instagram, RMTS_UT. That's for our whole company there. And then Facebook, just RMTS-West Jordan. And all of those, there's a link. You can download that. If you don't see it, you have a hard time finding it, just contact us and we'll email it to you or anything. We want to get that information out.
And we want to answer your questions. We want to offer a free, no obligation, 10, 15 minute kind of screen. Sometimes we hope to answer your questions with this tonight, but sometimes we've got to see what's going on. I had somebody call me once, a friend call me when COVID first started, and he's saying, yeah, my knee hurts when I do this. And, I ask him, well, how much is it moving? Well, I don't know. And is it moving when you move left or right? And so some of these things, sometimes it's hard for us to give an answer or a more clear answer without us seeing how are you moving. What does your spine look like? What does your posture look like? Do you have that really bad forward posture? Maybe your head is good, but maybe your low back has a really extreme curve to it. And so, if you want us to spend a few minutes with you, take a look. We're happy to do that. Again, there's no obligation, not going to charge you anything, not going to charge your insurance. If you call that number, 801-566-7080, we can get you set up and we'll spend a few minutes with you.
So back to this slide again. These are those conditions that we listed out. Right now is your time to make sure you can get in on the drawing for this backpack. But we want to hear, what are your questions? We got to present and teach you guys hopefully some information that's going to be helpful. But what are conditions that either you're dealing with or maybe you want to know more about? We want to answer those questions right now. So just throw that in the chat below. And then we've got some slides if we need to that we can go to. Right now is your time. What questions do you guys have, even if it's about a concept that we've covered already and it just wasn't quite clear?
Emily, you've thrown a few things in the chat. Hopefully we've given you a little bit of direction of what's going on. Is there anything else that you just posted? If you don't like taking OT over the counter, what are more natural remedies? I honestly, I'm not the expert in that area. I don't have a lot of good guidance to give you there.
Yeah, if we're trying to decrease inflammation or prevent pain, there are some different things like icy hot or what's that, BioFreeze that you can use. I've heard of. I'm not a nutritionist. That's something that talking with someone who's more of a conservative medical provider. My mom's actually a medical provider, and so she talks a lot about these conservative ways. I think it's ginger or something like that. I'm not sure. The best thing to do there is to find nutritionists or medical providers who know both sides, the medicine side and then the more Eastern medicine, herbal type of approach that can help you with that pain control. Honestly, I'm super biased about this, but natural remedy for pain is movement. Like that's your best ultimate thing. But if we're trying to decrease pain right now in the moment, sometimes we need something else.
I know a physician that she really uses some more natural kind of remedies and would be happy to direct you her way. If you want to give us a call tomorrow in the clinic, I'd be happy to chat with you and direct you her way. But she does some more natural, less Western medicine, drugs, over the counter kind of stuff. And so that's somebody that we can direct you to. But again, like Brad said, we have, as with our conservative motion is lotion kind of thing, that's as natural of a remedy as you might be able to find.
How do I? That's what I was looking for. Cool. Okay, do we have any other questions? Any conditions you guys want to hear specifics about? Because we don't take off yet. We've still got to give away the backpack, and we've got a slide that's going to have all the information. So if you need our phone number, our email address, so you guys can set up and come in and do it. Like John was talking about, that free consultation, sometimes you just want to ask your questions in person, or you want it one-on-one. Maybe it's more personal, and that's okay. That's totally understandable, and that's why we have that, so that we can chat with you in person.
More info on bulging disc, please.
I love this topic.
Go for it.
Let's go to the slide here. We've got a slide just about this. So there's the information. I'll come back to you that if you want to take a quick screenshot or something, or picture, that's okay. But we will come back to this for you guys. So let's go down. Bulging disc. This one is really, really cool. The research here on the left is from 2014. I'm sure they have some newer stuff. This one is just super popular. You'll find this out a lot. A lot of our doctors we work with are conservative spine specialists. They hand this out to like all their patients because they want to teach you when it's okay, when it's bad, when it's okay. So the most important thing to understand about bulging discs, everybody's got them. That's a huge generalization. But if you look at 30% on the right side of that, left side of the screen, but the right side of that, all those numbers, 30% of 20-year-olds have bulging discs if they have zero back pain. The only people allowed in the study were people without any history of ever having back pain. Almost 1 out of 3 20-year-olds. Those are those young kids, right?
Pretty amazing.
Almost all, I mean, a third, I guess that's not almost all. But by the time we hit 50, 60%, 2/3 of us have bulging discs without any symptoms, no pain, no problems, right? And then by the time we're 80, 84%. That's a lot. So bulging discs are not a problem unless they are. Now, to explain what that means is a bulging disc can exist. The problem is once that bulging disc is pushing on the nerve or pushing on the spinal column, that pressure can be what's aggravating the nerve, cutting off blood flow to your nervous system. Those are the real problem.
Hopefully that helped, Emily.
Yeah.
Then she says, is this because of stenosis?
Stenosis, that's another topic.
Go for it.
All right, so stenosis is a narrowing of a pathway or narrowing of an opening. So you can see here, spinal canal, right? That's that middle. I guess I can use the mouse. So right here, that middle part here, nice, healthy, wide open. And then over here, stenosis, where it starts to narrow and become a problem. Stenosis is really commonly talked about when the bone is growing and narrowing that space.
Narrowing around the spine or around the nerve.
Yeah. And so when that nerve, if you remember that other picture we talked about, the nerve exits right through this pathway here in between two of the vertebrae, two of your backbones. That space right through here can do the exact same thing. It can start to narrow and become a much bigger problem. So yes, that's the foramen. So a foramina is a hole, a space, a canal. And so the foramina right here can get narrow and compress that nerve. So then let's talk real quick about some treatments for that. We need to open that space. So stenosis treatment, one of the best things for it, but I want to mention stenosis is way more common after the age of 65. If you have back pain and you're over the age of 65, that means it's more likely. We're not saying you have it, but it's more likely. So then we can help guide you to make sure you're doing exercises that don't aggravate those nerves and compress them. Because that's one thing that I don't know any exercise to change bone mass, right?
I haven't figured it out yet.
Not yet.
I'm working on it, but I haven't figured it out yet.
So those bones have grown, and we're not going to show you a stretch or something that's going to change it. So now we got to move within the space that we have. So this exercise in the middle at the bottom, she's pulling her knees up to her chest. On the left side, some side-to-side motion, and on the right side, you've seen some of these where they're slouched forward to open up those spine. or pulling one knee up to your chest.
So to kind of go back, Emily, and kind of hopefully tie everything together, the discs can bulge with or without having those foramen narrow or without having the stenosis. And there's not necessarily one that's causing the other. There's kind of interplay between both of those. There's interplay between the disc, there's interplay between the foramen and the stenosis and that narrowing of the canals. They all kind of can work together to give you some discomfort, but one doesn't necessarily cause the other.
Yep. And obviously, if you have them both combined, that's going to be way worse because you've got the disc taking up space and the bone taking up space, and now there's just no space for the nerve to live. So that's going to be worse for sure.
Susan, I've had 3 fusions, 2 roots down, middle of the back. I have gone to Paul Wortley for a long time. My biggest problem is the muscles down the spine. Walk bent over from the middle of my back. I will take advantage of your one-time observation. Thanks for tonight. We'll be happy to work with you, Susan. We'll be happy to kind of check things out for you.
Yep. Awesome. Okay, do we want to do the drawing? While you get that ready, I'll go back a little bit. I'm going to go back just so you guys can have access. Can my name go in? I want to win this.
No.
So I'm just go back to this so you guys can write down any information. We love to send out our ebooks. We want to send out information, educate you guys. We do these classes once every single month, different topics. Next month is foot and ankle. If you've got plantar fasciitis, chronic ankle sprains, high ankle sprains, a fracture in your ankle, we're going to talk about all of that. And if you know anybody, please invite them. As you can see, we're doing all of this for free. So the more people we can help, the better.
My app that is a randomizer to see who's going to win is not hearing you.
That's a big problem. Let me write it down.
We'll write it down. We'll write it down and we'll draw your name out of the hat. Brad's got his magic cup. It's a jazz cup with Donovan. Is it Donovan that's on there?
I don't know.
Yeah, Donovan Mitchell.
Yeah, I knew that. All right, so we've got Emily asked.
Yep.
Megan, right?
And Susan.
And Susan.
Sorry, it's taken us a little longer than we thought. Emily, you wrote, will you email us about that foot clinic? Did we talk about a foot clinic?
Yes, the webinar.
Oh, the webinar.
Yeah, so we can send that email out to you guys. If you signed up for this, I believe that we'll send that out, right? So if you're signed up for this, then you should get an email about it. It doesn't automatically sign you up for the next one, but that way you have the link to sign up if you want to sign up there as well. So, all right, so we've got our names inside here. You ready?
You mix, I'll draw.
They're going to stick to the inside. It's a long cut. Okay, good luck.
Emily, hopefully you all can see that. Emily, you won our backpack. So we have your information. We'll reach out to you and get in touch with you and figure out how we can connect up and get that backpack to you.
Yeah, and you can always come by our clinic to pick that up. It's just we've got it with us here in our West Jordan location. The address is right there at the top. We really appreciate you for this. Who was that?
That was Emily. Thank you, guys.
Yeah, you bet.
And I'm going to call tomorrow and probably schedule an appointment just to follow up with my sacrum rotation or whatever I'm dealing with.
Awesome. That'd be great.
That would be perfect. We really appreciate you guys joining in on this. And if you have any family members who have back problems and you want to get them the same information, we'll work on getting the recording put together so that we can help you guys get that information to everybody else as well.
Okay. Thanks, everybody. Have a good night.